Hello, I'm Dr. Roberto Carricchio. I'm the chief of the Division of Rheumatology at UMass Chan Medical School in Worcester, Massachusetts. And I'm also the director of the Lupus Center at UMass Chan. I'm joined today by Miss Ruth Wilson, who's a patient with lupus, but it's much more than that. She's also a very strong advocate at the national level with a number of foundations, and also the director of our lupus support group in our center. Ruth, welcome.
Thank you so much for having me, and thank you so much for that very gracious introduction. I really appreciate your invitation to be here today.
So from a patient perspective, what would be the best way for the rheumatologist and the lupologist, so to call it, to help you best as a patient, besides the medications and the lab work?
I think compassion can go a long way, right? Because especially at the beginning, you feel like you're not being validated for your symptoms. And I found with a lot of doctors that I felt like I was being dismissed, and that, I felt like I was going crazy, like this must be in my head. So I think just validating that the patient is feeling these things, right? And I mean, they know their body best. So really listening and just showing compassion, I think really goes a long way, beyond the treatment, the medical treatment that you're providing. Just like, I don't know, just being there for your patient and saying that you understand that they are going through these things, that they're not crazy, right?
Yes, thank you. Also, it has been shown multiple times that if the physicians, if the rheumatologist is asked the top 10 items that worries them about the patient, and if the same question is asked and listed for the patients, what is the 10 top things that worries them, then if you match them, none of them align. Very interestingly, how do you think we can have a way to actually match those worries so that we can understand each other better?
Trying to involve the patient voice in everything that you do, it's going to align those sort of objectives more closely. I found that when the patient is empowered in their treatment, is empowered in asking questions, the care goes along a lot better. I really appreciate when my doctor says to me, next time we meet, bring 2 questions that you may have, and then we can discuss, right? So I think just even those kinds of things are important to give that patient a voice instead of just giving them orders, right?
Thank you.
Thank you so much for having me. This was a very useful information, that I hope helps other lupus patients. So thank you so much for having me.
Thank you, and let's thank also the audience that has joined us today to listen to us, and especially to your story. Thank you very much.